Welcome to Savitha Dental College Lecture Cast in Anatomy. The topic for today is the lateral wall of the nose. Moving on with the study of the nasal cavity, the lateral wall. The lateral wall of the nose separates the nasal cavity from the orbit above, maxillary sinus below, and from the lacrimal groove and the nasolacrimal canal in front. The lateral wall is characterized by the presence of vestibule. It's a small depressed area in the anterior part and it's a modified part of skin having a short stiff curved hairs called as vibrissae. Above this we have the atrium of the middle meatus which is bounded above by the agar nasal. The posterior part is characterized by the presence of the concha and meatus. The skeletal framework of the lateral wall is formed by bones and cartilages. The bones contributing to the formation of the lateral wall are the nasal bone, the frontal process of the maxilla, the lacrimal, the ethmoid, the inferior nasal concha, perpendicular plate of the palatine bone, and the medial pterygoid plate of the sphenoid. The cartilaginous contribution are done by the superior and the inferior nasal cartilages and alar cartilages. The cuticle is a fibrofatty tissue covered with the skin. Moving on to the concas. The concas are three horizontal bony projections which are covered by the mucous membrane. They increase the surface area of the nose for effective air conditioning of the inspired air. There are three concas, namely the superior concha, the middle concha, and the inferior concha. The superior and the middle concha are parts of the ethmoid bone, whereas the inferior nasal concha is a separate bone. Moving on to the meatus, there are four meatus. One above the superior concha is called as the sphenoethmoidal recess. The superior meatus is formed below the superior concha. Below the middle meatus, we have the middle concha, we have the middle meatus, and below the inferior concha, we have the inferior meatus. The sphenoethmoidal recess is present above the superior concha. We have the opening of the sphenoidal air sinus. Below the superior concha, we have the superior meatus. It is the smallest of all the meatus. We have the opening of the posterior ethmoidal air sinus. The middle meatus has got various features. It is present below the middle concha. We have an elevation called as the ethmoidal bullae. The middle ethmoidal air sinus opens in this. Below this ethmoidal bullae, we have a semicircular groove called as the hiatus semilunaris. Near the anterior end of the hiatus semilunaris, we have the infundibulum. In the hiatus semilunaris, we have the following opening. In the anterior end, we have the opening of the frontal air sinus. Behind it, we have the opening of the anterior ethmoidal air sinus. And in the center, we have the opening of maxillary air sinus. The maxillary air sinus is usually represented by two openings. In front of the middle meatus, we have the atrium of the middle meatus. It is above the vestibule of the nose. It is limited above by a faint ridge of mucous membrane called as the agar nasal. Moving on to the inferior meatus, it is present below the inferior concha. We have the opening of the nasolacrimal duct. The blood supply of the lateral wall can be divided into the four quadrants. The arteries supplying the lateral wall are anterior superiorly with the anterior and posterior ethmoidal artery and branches of the facial artery, anterior inferiorly, superior labial branch and the greater palatine artery, posterior superiorly, the sphenopalatine artery, and posterior inferiorly, the branches from the greater palatine artery supplies the nasal cavity. Moving on to the venous drainage, veins from the anterior part will go and drain to the facial vein. The posterior part is drained by the sphenopalatine vein, which ultimately drains into the pterygoid venous plexus. Lymphatic drainage, lymphatics from the anterior part goes and drains to the submandibular group of lymph nodes, and from the posterior part goes and drains to the retropharyngeal group of lymph nodes. The nerve supply, on the roof we have the olfactory mucosa, which has the olfactory nerves origin. The lateral wall sensory supply can be divided into four quadrants. The nerves taking sensation from the anterior superior quadrant or the internasal branches of the anterior ethmoidal nerve, in the anterior inferior quadrant, anterior superior alveolar nerve, and for the posterior superior, the medial posterior superior nasal branches of pterygopalatine ganglion and the posterior inferior band for the nasopalatine branches of the pterygopalatine ganglion. Moving on to the applied anatomy, common cold or rhinitis is very common. Thank you.